Okay, I'll start off with a case, and then we got, I think, a few others at the end. But we're a little obsessed with our bowels and our gut, and that's good news because it's one of the areas of our integrative and functional community that we have global international research looking at the microbiome and its role in health. But I think our obsession sometimes gets a little carried away, and between stool samples and probiotics, I think it's pretty much a wild west out there. So this presentation, I'm really going to focus on one marker that I think has some of the most significant implications for major mental illness and major mental health problems. And I'll start off with a case of a woman I saw a few years ago who was came in for anxiety, 6 milligrams of Ativan. So I assume some of you know Ativan is like Xanax and Valium. It's a benzodiazepine. A half a milligram probably would make me sleep, and a milligram is a lot. 3 milligrams is probably too much, and 6 milligrams is a significant amount of Ativan that she takes every day. So I was seeing a relative of hers, and she found out I do this nutritional testing. So we did our functional psychiatry workup, and I told her when we did it that I think we found the cause of your anxiety. And she was, very interested. We went over the results, which is what I'm going to share with you in this presentation. And, after the second session, she just realized that she would rather take her 6 milligrams of Ativan than to take the nutritional supplements and the protocol we're going to talk about. So oftentimes we can understand the underlying cause, but not all of our patients want to give up either their meds, particularly benzos that are addicting, and or the work needed. But when we talk about the gut, it is both fascinating, but just like every other aspect of functional medicine, and in our programs, functional psychiatry, we pretty much obsess about this concept of biochemical individuality. No two people have the same requirements for vitamin D, B12, and no people share the exact microbiome makeup. So it's hard to do protocols. We've heard and seen this enough, the second brain in our gut. And I guess one of the reasons I wanted to bring this up again is, you hear all over the internet, 95% of the serotonin is produced in the gut, right? 50% of the dopamine. And that's accurate because there's a tremendous amount of nervous tissue. But it is not the same serotonin that's going to be affecting whether you make melatonin and fall asleep well that night, or if you have other psychiatric symptoms. The nervous system in the gut is the nervous system in the gut. These neurochemicals are produced in milliseconds, and it's beyond our comprehension. So when people talk about the neurotransmitters in the gut, it's not easily translated to what's happening in the brain. So we'll just leave it. Now, the brain communicates through the gut, through the vagus nerve, and 100 other pathways, but it is not the same molecule because it's only around, again, for microseconds. So we know the gut microbes, they're great for everything. We can't live without them. They can't live without us. It's a pretty wonderful symbiotic relationship. We have physical symptoms if we are concerned about dysbiosis. And this kind of gets you to your integrative doctor or gets a stool sample. But what we're going to talk about are individuals that I've been seeing for 30 years that have very few physical symptoms of dysbiosis. But what they have are psychological and psychiatric symptoms. And we call this imbalance dysbiosis. And what is just missed, not as much in the literature, but clinically, is how this can affect psychiatric illness. So, the research, again, has been fascinating. Makes all of our jobs easy in that what we have is a relationship, right, between gut dysbiosis and all of these psychiatric disorders. And that's pretty impressive, if not kind of mind-blowing when you think about our current state of psychiatry and mental health care. And I'll just quote my favorite study. So it was bipolar disorder. People were admitted to an inpatient psychiatric hospital for bipolar. So which means you were pretty sick, either manic or suicidal. And when you left the hospital, they just gave you this over-the-counter probiotic, right? Small dose probiotic. And those that took the probiotic had dramatic, I think it was 60, 70% less relapse and readmission rates than those that didn't take the probiotic. Now, nobody knows why or what the mechanism, but it's just a pretty fascinating little simple study. Over the counter probiotic dramatically decreased relapse rates and readmissions for severe bipolar illness. Now, the problem when we look at the literature, and a lot of my career has been around eating disorders where we have profound disturbance in the gut, obesity, schizophrenia. I mean, you see what's in front of you. The problem is the clinical implications are, I think, far away. It just doesn't translate. So what I hope to do today is just focusing on one test, one marker with, I'm going to repeat again, one of the most profound clinical implications of my 30-year career, just to be dramatic. Okay, but we know there's a relationship with all these disorders. It's just a lot of hodgepodge in terms of what they mean clinically. We start talking about why we have this problem of dysbiosis. This is the partial list, and it's pretty endless. But certainly when I started my career as a child psychiatrist, at the time, every child who had any ache or pain or ear ache was placed on an antibiotic. So my child psychiatry career started with treating dysbiosis, mostly candida, from antibiotic use. I mean, I was seeing kids with 7 and 8 courses of antibiotics before they were 10. That's less. But you can look at all the other factors here that affect the bacteria, from stress to the refined diet that too many of our patients are eating. So there's lots of factors. The antibiotic piece will not go away because antibiotic use in kids and adults has profound implications many, many years later. So testing is important, particularly those seeking mental health treatment. My personal bias is stool testing is second to what I will share with you about organic acid testing. And I know you're going to have a class on that coming up. But besides all the other factors we talked about, the diet is the number one factor. So we know probiotics affect neurotransmitter levels. We, again, have this research on anxiety, on mood, that has been repeated over many, many years, but they're just kind of these associations with clinical implications kind of vague. So we're going to talk about one marker on the organic acid test, and we're going to talk about the first page, the microbial test, which you can get as a separate little lab. And we're not going to talk about candida and with the first half of the test, which is, I think, pretty simple to appreciate. We're going to talk about the bottom half of the test, which is, I guess I don't have a slide. It's the bacterial markers. And we're going to be looking and discussing a marker called HPHPA. Okay, we're going to go into this in detail, but let me tell you a little story. I don't know how many years ago now, maybe 6 years ago, I worked with, at the time, Great Plains Labs, and we had 150 patients. And we just kept track of who presented to an outpatient clinic, to our clinic at the time, and we did a organic acid, looked at the microbial organic acid to look for this marker, this Clostridia overgrowth marker called HPHPA. So most of the patients out of this 150 had two diagnoses, 86 versus 14%. And I used this slide because these aren't all diagnoses, but these are the symptoms, if you will, of patients who had this marker that we could identify in the organic acid. So pretty amazing, actually. Think about it, okay? These are direct from patient charts presenting to our clinic with elevations of HPHPA, a marker on the first page of the organic acid test. And the reason I'm focusing on this one marker, because I'm trying to help people kind of personalize a treatment plan based on objective data and not just throw supplements at our patients and just say, oh, take this probiotic or take this one. A functional psychiatry approach is looking at a test and using that interpretation. But this is pretty mind-boggling symptoms. Again, this is a psychiatric clinic. You can just take a minute and look at the symptoms of these 150 patients that had positive, and then we can go from symptoms for a minute into the diagnoses. So these were the psychiatric diagnoses, a lot of anxiety, ADHD, impulse control, bipolar for patients who had this marker. And the most significant were bundled around anxiety, 76%, some depression, some ADHD. Okay, so let's dissect what I'm talking about. So this marker is produced by strains of Clostridia in the gut. Now, I'm just making up these numbers, but there are hundreds of different strains of Clostridia in the gut, right? And maybe a handful, let's say 10, produce this marker, this metabolite. And so you see in the gut, the Clostridia bacteria, the little red guys, are going to produce as a byproduct this HPHPA, going to be absorbed in the bloodstream. It's going to get circulated throughout the body, crosses the blood-brain barrier, and we can detect it in the urine test. Now, why is this marker so significant? Because it wreaks havoc in this enzymatic pathway from dopamine to norepinephrine. What HPA does, it inhibits the conversion of dopamine to norepinephrine. I mean, it's that simple, but it's that dramatic. And I've said, and nobody has really proved me wrong yet, nobody feels well with elevations of HPA. That's why it's such an impressive test and marker. I have no affiliation with the labs here, but it is significant. You just cannot convert dopamine to norepinephrine and then epinephrine. So you have this buildup of dopamine and you feel bad. Now, it's not one symptom. I shared with you many symptoms from, early studies. We had a number of cases of OCD, but it certainly centers around agitation and anxiety. And it would also interact with your genetics, how you metabolize dopamine, your COMT profile, 100 other factors. But either way, you can't feel well if you have elevations of, okay. So here's the official chemical name. Not all species produce it. Dr. Shaw was the original one who discovered this, initially with autism. And so as a child psychiatrist, that's what got me interested in it. We've also seen it with schizophrenia early on, some case studies. But then it became part of my every patient workup. And we started seeing it across all those diagnoses that we just discussed with you. And here's some of his original studies 15 years ago, just much, much higher levels of HPA in the autistic community. I think that early studies kind of derailed us a little bit from thinking through how this affects, every other psychiatric illness, but it certainly kind of set the standard, and now we see it across many disorders. So we're going to talk about treatment. This was a gentleman, because I don't have, if I got the first, no, I don't have his first slide, but he was a young adult in his 20s with agitation, depression, irritability. Let's see where his level was over 300 and did well with just probiotics. We usually use a couple different probiotics we'll get to in a minute. A few months later, better, less stressed. Now, the punchline for this presentation is sometimes we need to use antibiotics. Here, 52-year-old female, anxiety, memory, she had gastric bypass and multiple previous treatments. Her HPHP was 284. We stopped supplements stimulating dopamine, used the probiotics, and she started feeling better. So here's the marker, number 16. I don't know if it's the same now on the lab test, but we've seen everything from 200 to 900 for that marker. I will repeat, nobody feels well, when it's over 200 because of that interruption of the conversion of dopamine to norepinephrine. Just a buildup of dopamine. Now, before we get how to treat it, I just want to make sure that some of your patients, like the first case I presented, she was doing okay on 6 milligrams of Ativan. So sometimes the patients aren't as symptomatic because they're just medicating. Although I can tell you, one case that I just finished treating markedly, she had elevations of HPHPA and had been to multiple doctors, and she took something close to the equivalent of 6 milligrams of Ativan, and it didn't touch her. It didn't help at all until we were able to bring down the. Okay, treatment. There are a couple parts of treatment, and we usually start with probiotics. Not on the slide, but Saccharomyces boulardii is typically part of my protocol. So starting Saccharomyces boulardii twice a day to start. It's usually the simplest. And then I use a multi-strain probiotic. The Lactobacillus rhamnos, has been shown to be helpful. So we try to use that as part of the multi-strain. So I say here high dose probiotics. I've sometimes had to gone to 2 to 300 billion CFUs. And this is when I'm just looking at using probiotics. So we have this bacteria, a Clostridium, that is producing a metabolite. So by taking one probiotic pill, we're not going to get rid of that Clostridia. So we're talking about high-dose probiotics. I often use multi-strain. The last few people I've seen had been taking probiotics. And so if someone's been taking them and this condition gets worse, then obviously stopping the probiotics they're taking. And then we're going to go into medication now. I wrote here in this slide, if no improvement in 2 to 3 months, we add an antibiotic. And that's really clinical judgment. I'd say most of the kids that I've seen, I've not needed to use an antibiotic. And in some adults, I've switched to the antibiotic in 1 to 2 months because their symptoms are so severe. I've seen such severe brain fog and severe anxiety on elevations of HPHPA that I just use the probiotic for 1 or 2 months, but I just can't see them suffer because, as I said, there's something driving the anxiety, and often medications aren't sufficient, the anti-anxiety medications. So let's talk about the antibiotics. So vancomycin and flagyl are the two antibiotics that have been shown to be helpful. And the protocols that make the most sense where we've seen clinical improvement has been over a kind of a pulsing 30-day treatment protocol. Okay, so bear with me for a minute. I use vancomycin more often than flagyl. So let's talk about vancomycin. So it's a 10-day course of the antibiotic, usually 3 times a day, but it's over 30 days. So they would take vancomycin day 1 and then 2 days of the Saccharomyces and high-dose probiotic. And then on day 4, they would take their next dose of vancomycin. So you're stretching out the 10-day course of an antibiotic over 30 days because between the spores and the growth, often a 10-day course isn't sufficient and you're just repeating too many 10-day courses, and that's just more antibiotic. And as a psychiatrist, you can imagine I do not throw around antibiotics. I actually never do, except for in this incident. But I've seen too many people suffer tremendously. Again, anxiety, irritability, agitation, exacerbation of bipolar psychosis, and in young children's autism. So when I know there's a mechanism of relief, it's hard not to recommend the antibiotic. So probiotics, I use somewhere between 1 to 3 months. And again, in kids, it's often, I'd say for years, when I was mostly seeing kids, I never got to vancomycin. They just get better. Slowly titrate the dose. And then you're repeating the test. You have a marker, you have an objective marker, elevations of HPA, it's 350 at 1 day. 3 months later, you repeat it, it's down to 120. You did the right thing. If it's still at 320, then you have to be either a little more aggressive with the probiotic or jump to the antibiotic. Okay, so in my world, as a functional psychiatrist, I'm recommending a organic acid in every patient that walks in the office because you're potentially missing some incredible path towards aggravating that patient's mental health symptoms. But some of the markers, I guess, if you have to pick and choose based on your patient population. One is all the GI symptoms of dysbiosis. Don't just jump to a stool sample. You cannot pick this up in a stool sample. So any of the physical symptoms of dysbiosis and poor response to a stimulant. Okay, so in the ADHD world, we know, I don't know, 90% of kids do okay on a stimulant. And then there's that 10% with side effects. And so if someone gets worse on a stimulant, that's not just dose related, that at the lowest possible dose, then that is where, well, we have two markers we look at. One, testing for high copper, but also it would be a marker for testing for. Okay, so in my world of eating disorders, anorexia, and obesity, one of the most striking findings is the lack of microbial diversity due to these restrictive diets. So it does appear that diversity is a key to health, or certainly gut health related to psychological health. Probiotics, I think, should be part of our mental health toolkit. Randomly throwing probiotics at people in the research actually has been shown to decrease anxiety and depression, but usually not sufficient and not enough. So we try to look at objective data. HP is one of them. And again, careful, some of the probiotics, there might be gluten in or dairy. We didn't talk about all the other aspects of dysbiosis, from SIBO to candida, overgrowth. Again, candida is common. It's commonly missed. It used to be a significant part of our practice when everyone was put on antibiotics, but we still have to look for it. It's challenging to treat with diet, and often if markers are significant, we look at both herbal anti-candida supplements as well as medications, things like nystatin or diflucan. Okay, so that's the official presentation. I'm going to just go back. If this is new to you, we're looking at marker 16 on the organic acid called HPHPA. You see underneath some of the Clostridia species that produce this marker. And this is what this guy does. It inhibits this enzyme, converts dopamine to norepinephrine. So we have symptoms. And what I'm going to keep going back here to the symptoms in our study of 150 people. Can you guys see that? These are the kinds of symptoms that we saw for people coming in with elevations. So everyone who walked in, the first 150, they did their organic acid test, and the ones that were positive, this was on their history of present illness. So since it covers such a dramatic, wide range of mental health symptoms, we can't just say, oh, we're only going to check if someone has anxiety. We're only going to check if someone has panic disorder. You see eating disorders, mood dysregulation, obsessive thinking. Some of the first few cases that we published and we wrote about were elevations of HPA with classic OCD in 2 adolescents. The best clinics, the best doctors around the country, best medications, best cognitive behavioral therapy, nothing helped. 16-year-old who, just vividly remember, got stuck in a door, had to go in and out of a doorway for hours, couldn't get to school. Elevations of HPA. The sole treatment for this child was high-dose probiotics. It took a number of months, a multi-strain and Saccharomyces, and the OCD tremendously improved. Didn't go away completely, still had OCD, but they were able to get to school and function. And we had 2 cases that we wrote up there.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.